If you notice that you're constantly clearing your throat, if you wake up every single morning with that thick, sticky feeling at the back of your throat, if no matter how much water you drink, no matter how many times you swallow, there is always something sitting there that just won't go away, I want you to stop right now, because what I'm about to tell you is something your doctor probably never had the time to explain properly. My name is Dr. Zack, and in today's video, I'm going to break down the real reasons so many people deal with chronic mucus in the throat, not the surface level explanation you find on a basic health website, but the actual mechanism happening inside your body that most people completely misunderstand. And the reason this matters is because the wrong understanding leads to the wrong solution. And that means millions of people are treating a symptom and completely ignoring the cause. Before we go any further, if you haven't already, please hit that subscribe button right now. Every week I put out videos like this one where I explain real medical topics in a way that actually makes sense for your everyday life. Don't miss the next one. Now let's talk about what's really going on. Your body produces mucus every single day. That's not a problem. That's actually a sign that your body is working. The mucous membranes lining your nose, your sinuses, your throat, and your airways are constantly producing a thin, watery fluid that does several incredibly important things. It traps dust, bacteria, allergens, and particles before they can reach your lungs. It moisturizes the air you breathe. It protects the delicate tissues of your airway from drying out and cracking. On a normal, healthy day, you are swallowing mucus continuously, and you never even notice it. That's the system working perfectly. So the question isn't, why do you have mucus? Everyone has mucus. The real question is, why has it suddenly become noticeable? Why does it feel thick? Why is it always there? Why does clearing your throat bring temporary relief, but 5 minutes later it's back again? And this is where things get genuinely interesting. In the vast majority of cases, when patients come to me describing exactly this, that persistent feeling of mucus sitting at the back of the throat, the condition isn't actually in the throat at all. The throat is just where you feel it. The origin is somewhere else entirely. And until you understand where it's coming from, you can gargle with salt water forever, and it will never fully go away. The single most common hidden driver of chronic mucus in the throat is a condition called post-nasal drip. And before you say, "Oh, I've heard of that," stay with me, because most people think they understand this and they don't. They think it just means their nose is running down their throat. But it's so much more nuanced than that, and getting the nuance right is what changes how you actually handle it. Your sinuses are hollow spaces in your skull, 4 pairs of them, and they connect to the back of your nasal passage. Under normal circumstances, mucus from the sinuses drains quietly and smoothly down the back of your throat, and you never feel it because the texture is thin and light. But when inflammation hits, whether from allergies, a mild infection, dry air, air pollution, dairy sensitivity, or even hormonal shifts, the mucus quality changes. It thickens. It becomes sticky. It moves slowly. And instead of sliding cleanly down your throat, it accumulates. It coats the back of your throat like a film. And your brain registers this as a sensation of congestion, fullness, or something stuck there. And here's the part most people miss entirely. The act of clearing your throat, that instinctive, forceful ahem, actually makes the problem worse, not better. Every time you forcefully clear your throat, you are causing minor trauma to the vocal cords and the lining of your throat. That irritation triggers more mucus production, which makes you want to clear your throat again, which produces more irritation, which produces more mucus. You are caught in a biological loop, and the harder you fight it, the more your body responds by producing the very thing that's bothering you. This is one of the most overlooked cycles in ENT medicine, and understanding it alone can be genuinely life-changing for some people. But postnasal drip isn't the only cause worth knowing about. There's another driver that is growing more common, especially among adults over 35, and it's one of the most misdiagnosed conditions in everyday medicine: acid reflux. Now, when most people think of acid reflux, they think of heartburn, that burning sensation in the chest. But there is a form of reflux called laryngopharyngeal reflux, or LPR, where stomach acid travels all the way up past the esophagus and reaches the back of the throat and larynx. And what makes this particular form so deceptive is that many people with LPR have no chest burning at all, none. Instead, what they feel is a persistent sensation of mucus, a lump in the throat, a frequent need to clear the throat, and sometimes a mild chronic cough, especially in the morning or after eating. The acid, even in small amounts, irritates the throat lining. The throat responds by producing a protective layer of mucus, and now you're back to that sticky, frustrated feeling. But this time it wasn't nasal at all. It was gastric. 2 completely different origins, same sensation. And if you are only treating one while the other is driving it, you will go months or even years without real relief. This is exactly why I always say to my patients, don't just chase the symptom. The throat is a messenger. Listen to what it's telling you about what's happening upstream and downstream. There are other contributors as well. Allergic rhinitis, whether you've been formally diagnosed or not, is one of the most common unrecognized causes of chronic throat mucus. Many adults live with low-grade airborne allergies to dust mites, mold, pet dander, or seasonal pollen without ever connecting their throat issue to what's in the air they breathe at home or at work. They've adapted to the sensation over years. They think it's just how they are. But their immune system is quietly, consistently producing inflammation in their nasal passages that keeps the mucus churning. Dry environments play a role too. When the air you breathe is chronically dry, whether from air conditioning, central heating, or the climate you live in, the mucous membranes try to compensate by producing more mucus. But paradoxically, the mucus produced in low humidity conditions tends to be thicker and stickier rather than thinner and cleaner. This is why even people who drink plenty of water sometimes still feel congested, because hydration helps, but environmental humidity matters too. Smoking and secondhand smoke exposure directly damage the cilia, the tiny hair-like fibers that line your airways and sweep mucus along in a coordinated rhythm. When those cilia are damaged, mucus can't move the way it should, and it stagnates. Food sensitivities, particularly dairy, can thicken mucus in some individuals. Certain medications, including blood pressure medications in the ACE inhibitor class, list chronic cough and mucus sensation as a documented side effect. And this brings me to something I want you to hold on to, because it reframes the whole conversation. There is almost never just one cause. In most people I see with this complaint, there are 2 or 3 overlapping contributors. A mild allergy they haven't addressed, a reflux pattern they don't know they have, air in their bedroom that's too dry, and a throat clearing habit that has become reflexive and self-perpetuating. Take any one of those away and they feel a little better, but address all of them thoughtfully and the difference is remarkable. So what do you actually do about it? Let me walk you through the approach that makes real clinical sense. The first thing is to stop clearing your throat with force. I know this feels impossible. The urge is overwhelming. But the technique that actually helps is a gentle, silent swallow instead of a forceful clearance. It moves the mucus without traumatizing the tissue. Over time, the reflex arc settles down. If there's any possibility of post-nasal drip, nasal irrigation with a saline rinse is genuinely effective. It's not glamorous, but the evidence behind it is solid. It mechanically clears mucus and allergens from the nasal passages and reduces the volume that drains down your throat. Done consistently, not occasionally, it makes a real difference. Look at your environment. A humidifier in your bedroom, set to around 40 to 50% relative humidity, can reduce the viscosity of nasal mucus and the sensation of throat congestion significantly. Check your air filters. Consider whether you're regularly exposed to dust, mold, or animal dander. If you suspect acid reflux, especially if the mucus sensation is worst in the morning, after meals, or after lying down, pay attention to the habits around eating. Late meals, lying down within 2 hours of eating, caffeine, alcohol, and highly acidic foods can all contribute. This is worth discussing with your doctor, who can evaluate whether medical treatment is appropriate. If you've had this sensation for years and none of the obvious answers seem to fit, it's worth being evaluated by an ENT specialist. A rhinoscopy can visualize the back of the nasal passage and throat directly. An allergy panel can identify sensitivities you didn't know you had. A laryngoscopy can check for signs of silent reflux affecting the vocal cords and throat lining. These aren't extreme steps. They're how you stop guessing and start actually solving the problem. And if your symptoms are accompanied by significant difficulty swallowing, unexplained weight loss, blood in the mucus, a lump in the neck, or symptoms that have been worsening progressively, please don't wait. Those are signals that deserve prompt professional evaluation, not home remedies and patience. Now I want to pause right here in the middle of this video to ask you something. Have you been dealing with this for a long time, maybe years, and just accepted it as your normal? Because that's one of the most common things I hear. People say, I've always been like this. And sometimes that's true, but often it means they've just adapted to a problem they didn't know was solvable. If this video is giving you language and understanding for something you've carried quietly for a long time, I want you to know that's exactly why I make these videos. If this channel is helping you understand your body in a way that your clinic appointments sometimes can't, then please subscribe right now if you haven't already. It genuinely helps me reach more people who need this information. Let's bring this home. Mucus in the throat is one of those symptoms that feels minor, but when it's persistent and unexplained, it's your body trying to tell you something meaningful. The causes are real, they are treatable, but they require the right understanding to address properly. Post-nasal drip from allergies or sinus inflammation, silent acid reflux, environmental dryness, medication effects, throat clearing habits that self-perpetuate. These are not abstract medical mysteries. They are specific, identifiable, addressable patterns. The mistake most people make is treating the throat directly when the origin is somewhere else. And the second mistake is doing nothing because the symptom feels too minor to take seriously. Neither extreme serves you well. What serves you well is understanding the system, the airway, the stomach, the sinuses, the environment, as one connected whole. When something feels persistently off, it's worth the conversation with the doctor, not out of fear, but out of the kind of self respect that says your quality of life and comfort matter. That sticky feeling at the back of your throat every morning, you don't have to just live with it. There are real answers. You just needed someone to explain where to actually look. If this video gave you clarity on something you've been wondering about for a while, drop a comment below. Tell me how long you've been dealing with this, or which part of this explanation was most useful to you. I read every comment, and it genuinely shapes what I cover next. Share this video with someone in your family who's always clearing their throat and wondering why. It might be exactly what they've been looking for. And if you haven't subscribed yet, this is the moment. Hit that subscribe button and the bell notification so you don't miss what's coming next. Every week, I go deep on topics like this one, real medicine, explained properly, for people who want to understand their health and not just be handed a prescription. I'll see you in the next video. Take care of yourself.